This is Lazlo, and he's been coming to us since the middle of April of '06. When he came in, he had severe meniscal damage to his stifles. Apparently, we presume in his history that he had anterior cruciate ruptures or damage of some kind. He had a real nasty lick granuloma going that had been unresponsive to conventional treatment. So he's been coming to us for 5 years now, and like Carlene says, she's been bringing him here for 5 years and he still can't walk normally. So, you know, but we try. And he's actually responded very well. He could barely walk when we first started treating him, and my orders from the owner were I had to make him better because she couldn't let him go. So anyway, we're at 5 years later and he's 13 now?
Yeah, 13.
Yeah, so he's done pretty well. We're pleased with what we've been able to do. He has had nothing but laser therapy since we started working on him. So we'll start out, we started out just working on the stifles on this guy, but of course now at his age, we have arthritis just about everywhere that you can point. So I usually do some acupuncture points on this guy, and then we'll also use the Advantage probe to do some laser bath treatment on him.
Does it hurt or does it lessen?
No, they never feel anything with this, which is nice. We're gonna be all over the place here. You're okay. Where's your other foot? There we go. And what I like about doing acupuncture with this is not only is it quick, but as you can see, this guy can just kind of lay here, and you know, unlike the needles, I can get just about anywhere I want to be and get the treatment accomplished. And I don't worry, we're using a 2 joule dose minimum on these points. And I don't worry so much about the frequency as far as tonification and sedation of points. I never worried too much about that even when I was doing the needling. I'm fairly convinced that if you stimulate a point, it'll kind of take care of itself. One thing I do, I'm here at bladder 54 now, and I actually just leave the probe a little longer than 2 seconds to get the localized effect of the laser, or I can also just pop this off and use this, and about an 8 or 10 joule treatment time. Okay, so we'll stop that. And change to the Advantage probe. So now I've put the Advantage probe on, which will actually give a laser bath an area the size of the probe. We've got the power setting at 500 millivolts, which is, or milliwatts, which is as high as you can go with it. And my pulse setting will be at 4672 for this. This unit is nice because you actually can go into the protocol setting on this thing, and I can just say large joint, large dog, and it sets itself for me. so I don't have to worry about remembering anything, to be honest about it. So we'll do that, and we'll do a laser bath over the stifle area, which will last about 3 minutes and 20 seconds on each stifle. With this unit, I can't do it wrong. I can only do it right. If I overtreat, nothing's going to happen. So you get your effect, and then it will maintain that effect, but without doing any damage to the tissue. There's no heat, there's no burning, anything like that. Okay, we've finished this treatment with Lazlo, and it's taken us a grand total of about 10 minutes to do a total acupuncture treatment and local laser bath to the joint area. As I mentioned, this probe is really nice. It only takes a few minutes to do a treatment. You get good penetration with this. You'll get up to 5 centimeters of depth, and it delivers a maximum of 60 watts of power, so that's a lot of energy going into this joint. Lazlo, we're seeing him recently about every 2 weeks. He's reached the age where things were kind of catching up with him. We were on a once a month schedule. Actually, at one point we were about once every other month, and I find that my average early hip patient once every couple of months is adequate after the initial treatments. My standard protocol is once a week until we see results. This typically will take maybe 2 treatments. The response to treatment with laser is very quick. I've had a lot of patients that came in for their first treatment. The client will remark as they're checking out, said, "Look at that, he's walking," you know, things like this. So response time is very quick.